We thought they were just plain naughty children, but we didn't know that at that time how all the things that have happened to them affected them. We didn't know that those behaviors were because of the abuse they went through. We had no idea.
Trauma occurs when there's an overwhelming event or events that render a child helpless, powerless, or creates a threat of harm or loss. The event can be physical, sexual, or emotional abuse, chronic neglect, exposure to domestic violence, inconsistent caregiving due to parental substance abuse or mental illness, or even multiple moves within the foster care system.
They had been through neglect, abuse, sexual abuse, physically being beaten, most of the time homeless, a lot of times didn't have food.
Trauma and toxic stress affect a child's brain development. It can impact his or her ability to learn, regulate emotions and behaviors, use effective coping skills, engage in positive relationships, and so much more. Toxic stress has a cumulative effect. Children who have experienced untreated trauma have a greater likelihood of developmental delays, academic failure, and future mental and physical health problems, including heart disease, diabetes, substance abuse, depression, and even earlier death. Children with ongoing traumatic exposure also struggle with a positive self-concept, often blaming themselves for the abuse, feeling powerless, unworthy, and even unlovable. As a result, children can demonstrate a variety of behavioral issues that are often difficult and confusing to caregivers. The cycle of trauma can become intergenerational. Many adults who are abusive have their own childhood history of trauma. Without treatment, children who have experienced trauma today are more likely to continue the cycle of trauma with their own children tomorrow. The impact of trauma has a ripple effect. What happens to the children and families in our community eventually affects everyone, within our schools, worship centers, places of work, neighborhoods, and beyond. The health and wellness of our community is dependent on the quality of care provided for those at greatest need. The mission of the Children's Trauma Assessment Center is to promote compassionate understanding and support for children and families who have experienced trauma. CTAC conducts comprehensive neurodevelopmental assessments for children who have experienced trauma that measure a wide scope of a child's development. CTAC's team is multidisciplinary, including professionals from the fields of social work, occupational therapy, speech-language pathology, and medicine. It is the only site in Michigan that provides fetal alcohol spectrum disorder diagnosis within the context of a child's trauma. Psychosocial interviews are also conducted with the child to better understand the impact of trauma from his or her perspective. CTAC engages parents and caregivers to help them understand trauma and its effects on a child by providing one-on-one consultations as well as workshops for both foster and biological parents. Post-assessment recommendations developed by clinical trauma interventionists help guide caregivers in meeting the unique needs of their children, mitigating the impact of toxic stress, and building resilience.
CTAC taught us how the children's brains worked, how they reacted to different things, how to help them through some of the trauma they'd been through.
In an effort to create trauma-informed systems of care that further support the health and healing of children and their families, CTAC also provides trainings on trauma and interventions to service providers within the child welfare, educational, mental health, judicial, and medical systems across the state of Michigan and nationally. CTAC's goal is to change the question from "what's wrong with this child" to "what happened to this child?"